Hello everyone. As we all know, we have Dr. Aditi Singhvi ma'am here, who is a heart failure specialist and a transplant consultant at Narayana Health City, Bangalore. Today we are here to talk about the topic what women should know about heart diseases. As we all know, ma'am specializes in heart failure per se, and if you are a woman, if you care for one, then this is the talk for you. As we all know that men and women are created differently, the way heart disease is present in women progress and the treatment options and the outcomes are very different as compared to men. As we all know, sometimes women are misinformed in the sense that heart diseases are primarily diseases for the man. But we would be surprised to know actually that a lot of women die from heart diseases more as compared to all cancers combined. So, ma'am, is there anything specific to women, how heart disease is present in women?
Thank you, Dr. Mimansha. I think this is a very relevant question. The most important thing for women to know is that heart attacks can present differently in women compared to men. So when we typically think of chest pain, that may not be present in women at all. In fact, women may have pain in their arm or neck or even in their stomach area. Sometimes it can just be nausea, vomiting, excessive amounts of fatigue, or just giddiness, a lot of sweating. So those are symptoms that can actually be presenting symptoms of a heart attack. So if you have any of these symptoms, then don't ignore these symptoms and seek help immediately.
Right, that's a great point. So, ma'am, speaking of a heart attack, we are all aware of the traditional risk factors. There is a sedentary lifestyle, smoking, lipid disorders. Are there any other risk factors which are unique to women?
That's a very important point. Specific things that women should be aware of, most importantly, I think, are pregnancy-related issues. So if you've had pregnancy-related high blood pressure or diabetes, preeclampsia, preterm baby, or a baby that was small for age at the time of birth, those all increase your risk of having heart disease in the future. Then other things like having early starting of menstruation or early menopause, those are also risk factors. Menopause itself increases your risk of having heart disease. Then certain other diseases like having polycystic ovarian syndrome, immunity related problems like SLE or rheumatoid arthritis, as well as taking birth control pills, those can all increase your risk of having heart attacks as well.
Thank you, ma'am. That's great. So, is there anything besides heart attack that women should be aware of?
Absolutely. So, traditional heart attacks are formed by blockages from cholesterol forming in the arteries of the heart. But interestingly, women can also have heart attacks without blockages forming in the arteries of the heart. And those can be because of various things like a blood clot going to the arteries or even a tear forming in the arteries of the heart. Another important condition is heart failure, that is weakening of the heart muscle. And interestingly, it can be related to pregnancy also. So it can happen during pregnancy or even after pregnancy. Other things are broken heart syndrome, which is the heart becoming weak because of an undue amount of stress. And that can be excitement also or negative stress as well. And then breast cancer is another important thing where the breast cancer treatments can cause various forms of heart disease, including radiation as well as chemotherapy. They can cause blockages in the arteries. They can also cause the heart muscle to become weak. And this can happen even years after cancer treatment. Another interesting kind of disease is the heart failure, where the heart becomes very stiff, known as heart failure with preserved ejection fraction, seen more commonly in women.
Okay, thank you, ma'am. That was really great. How would women know that they are having heart failure? Like, how would they identify their symptoms? Are there any clues?
Absolutely. Those are all important for women to know. So if you're feeling extremely short of breath, you're unable to do things that you're usually able to do, like household work, cleaning, wearing your clothes, or walking, exercising, leg swelling, stomach swelling, losing your appetite, or you get full very easily, nausea, vomiting, giddiness, fainting, all of these symptoms are concerning and you should seek help immediately.
Yeah, ma'am. So another thing that I wanted to talk about is women are considered to be natural caretakers. They are always busy looking out for other family members. They take care of the entire household. Often their own health takes the back seat. So I was just wondering, is there anything specific that women can do to take care of themselves better and prevent heart diseases?
Absolutely. That's a very important thing that you've talked about, Mimansha. So, the first thing is that you need to know your risk factors. And remember that your risk factors will change with age.
Yeah.
Some of the traditional risk factors that we talked about, like high blood pressure, cholesterol, those remain relevant throughout your life. But then there are certain times in your life when you will have different risk factors, like around the time that you are pregnant, you'll have risk factors like having pregnancy specific high blood pressure or cholesterol. After menopause, your risk increases as well. Your risk of having high cholesterol, high blood pressure, all of those things increase after menopause. The next thing is that you need to have routine health checkups at all stages in your life. Make sure you see your doctors regularly, get your blood pressure checked, get your sugars checked, get your cholesterol checked. And know these numbers and keep a track of these numbers. In addition, keep a track of your weight as well, your body mass index, and how things are changing.
Yeah.
The next is to make sure that you get enough exercise. So around 30 to 45 minutes of exercise 4-5 times a week is very good for your heart. It can be anything like brisk walking, jogging, swimming, cycling. And if you have any heart condition, then ask your doctor about what exercise you can do safely and what will be good for you. There may be certain things that you are not supposed to do depending on what condition you have. The next is to follow a healthy plan. So there are Mediterranean diets, DASH diets. These are very good heart healthy plans. They are basically focused on making sure you get a lot of fruits and vegetables in your diet, lean meat, so that's chicken and fish, nuts, whole grains. Those are very good for the heart. And most importantly, follow portion control. Whatever it is that you're eating, cut down on the portions a little bit. And important, when you're following any diet, you don't want something that you're not going to be able to sustain. So it's okay to allow yourself a piece of cake or something like that once in a while, but it shouldn't become a regular thing. It should be a diet that you can maintain.
That's right.
Next also is to make sure that you reduce stress in your life, whether that's physical stress or emotional stress. Do things to take care of yourself, whatever helps you unwind, whether it's music, sitting with your friends, talking to your loved ones, whatever it is, take some time for yourself to stress. Getting enough sleep is also extremely important. Lack of sleep, less than 6-7 hours of sleep is not good for the heart. Most importantly, listen to your body. So if you feel like something is off, you feel like you're not your usual self, talk to your doctor immediately and don't ignore those symptoms.
Wow, that's great, Dr. Aditi. Actually, the points that you've said are actually the recommendations that are made by the American Heart Association, the European Society of Cardiology, and even our Indian Cardiology Society of India. So those recommendations are backed up by robust scientific data. That was good to know. So Dr. Aditi ma'am, are there any closing remarks? Are there any take-home messages pertaining to today's talk?
Right. So I want all women to take charge of their health, stand up for yourself, get screened, be aware of your risk factors, don't ignore any symptoms. Lastly, I know it can be upsetting if you or your loved one have heart disease, but there's good news. One is you're not alone. There are a lot of people living with heart disease out there. And now with the diagnostic capabilities we have and the treatments that we have, more people with heart disease are living longer and healthier lives.
Yeah. Wow, that's wonderful, Dr. Aditi ma'am. I hope the information that you've provided us with today will be very helpful for the people out there, especially the women and the men who are looking after the women they care about. Thank you once again very much.
Thank you.